NHS waiting lists have risen for the third month in a row, new figures show. Health Secretary Wes Streeting says the numbers show 14 years of Conservative neglect left the NHS broken. And that is fair now, undoubtedly. Well, it's fair to make that political point. But in a few months' time, we're going to want to see a change, aren't we? Let's speak to an expert. Dr Lizzie Toberty is GP lead for the Doctors Association UK and is a practising GP in Newcastle and joins me now. It is a new government. They have inherited these figures. When do you think we might see a change, and what would bring about that change, Doctor? Good morning.
Good morning, Nick. So, look, as a GP, these figures don't surprise me at all. I'm really shocked. You know, there's no doubt as a nation we are sick, we are unhealthy. There's 1 in 9 of us waiting for treatment at the moment. And I don't think that there's any quick fixes. I know about the suffering and I know about the difficulties that our patients, and not just the patients themselves, but their families, their carers around them are having. And that when we have these problems, it starts to put pressure on the rest of the service, because a problem initially then creates problems with pain, depression, and people have to go somewhere with those issues. And so you can see how things quickly escalate and you can have huge pressures there. So I'm glad that this is a top priority for the government. It needs to be, because actually if we can bring these waiting lists down, I'm convinced we will reduce some of the pressures on the acute parts of our service. OK, so, Doctor, you've given us the problem. I have your diagnosis. Doctor, what is the treatment that we need? OK, so I think we need to tackle this from
Here's the prescription.
A number of different angles. Okay, so you know, yes, you know, the short-term fixes. Could some patients go to places where there's shorter waiting lists? Can we empower patients to do that? There's been mention of you know, the private sector being used. I'm not particularly keen on that myself, but really this needs investment. They need to pay overtime, and we need to actively get this down. But I want to be clear that this is an investment in our health service, in our economy, and getting us well and back on our feet again. But also, I think the other angle that we need to take this from is public health. We need to look at the reasons why we're unwell, why we're getting unwell. And the public health budget's been slashed by about 1/3 in real terms since 2010. And we need to urgently look at and try and improve the health of our nation proactively, and not just wait till people are getting unwell.